Welcome to the Oxford Health educational presentation outlining the evidence-based wound dressing procedure for nursing practice. This procedure is integral to the Trust's clinical standards for managing patients with wounds. There are many factors which can contribute to delayed healing and incidence of infection. Performing a safe aseptic non-touch dressing procedure is deemed as an effective way of reducing this. There is an expectation that all healthcare professionals will adhere to this procedure in practice as part of a holistic patient management plan. Decontaminate your hands using the following hand washing procedure. Ensuring hands are dry, apply non-sterile gloves, minimising where possible contact with the patient's environment. Open dressing pack onto a cleaned working area. To avoid repeating the process again, ensure you maintain a sterile field. Remove apron and place within the cleaned working area. Using the plastic bag as a sterile glove, remove the galley tray with gauze and the wound measure tool and place them all within your cleaned working field. Continue to arrange your sterile field accordingly. Next, apply the plastic apron by placing it over your head. Peel the outer edges around your waist to expose the sterile surface. Remove old dressings and place these into the waste bag. Conduct your wound assessment and complete measurements and decide the dressing regime in line with the outcomes of this. Remove gloves. If your hands are visibly clean, decontaminate them using the alcohol gel. If your hands have visible debris, use the hand washing technique with soap and water. Ensure you have selected your dressings and decontaminated your hands again before moving on to the next stage. Having selected your wound dressings and decontaminated your hands, open the sterile items and drop them onto your sterile field. Open packets in a way to avoid contamination risk. If you're using a non-sterile dressing and/or the wound tracing grids, these can be placed within the cleaned working area. Please refer to points 3.1 and 3.2 within the wound standards when deciding on the best cleansing method for the wound needs. If using the dressing pack tray, add warm tap water and place it within the cleaned working area. If applicable, apply emollient to the skin. If using a tub, this should be decanted from the pot using a spatula or clean glove. Do not dip contaminated hands back into the pot. Having removed your non-sterile gloves and decontaminated your hands, apply sterile gloves from your sterile field. Pick up and apply dressings to the wound using sterile scissors to cut to size if applicable. Place all dressing materials and any unused dressings into the waste bag. Ensure used scissors are placed into the sharps bin and that new sterile scissors are used each time for future dressing procedures. Remove your gloves and place them within the waste bag. Next, remove your apron, peeling from the neck down first and folding in the sides to the centre, rolling the apron down on itself. This reduces the risk of contamination of external surfaces, including uniforms. Ensure bag is well sealed or double bagged before being disposed of in general waste bin. Now wash your hands.